Hello, my name is John Murphy and I'm an Advocacy and Research Officer with EPIC. Around this time last year, March of last year, when the first lockdown came, we decided that it would be a good idea to contact the residential centres and to see how they were getting on. And the main rationale around that was just to check in with them, see how they were doing, see what challenges the young people were having in the centres at the time, to determine if there was any issues for the staff and management, and also to look to see if work practices had changed during the time there as well, and to try and just give them any extra supports if they needed. So it was a survey that we sent out. It was pretty basic. We broke it down into 4 major questions. The first part looked at the issues for the young people. The second part would have been looking at the issues around what the staff were going through at that stage. And the third part would have been what extra supports they would have needed at that stage. And then the fourth and final part was just any other issues that would have been there. The first part, the impact on the young people, we broke down into 6 different areas: feelings of isolation, family access, disruption to education, social distancing, is there strained relationships with staff, or is there strained relationships with other residents as well. And thankfully, the results that came back were really, really positive at the time. Feelings of isolation, I think a lot of social media around helped that, and technology. And that was also the main issue around family access, that the managers and the staff were saying that people were using technology, having family contact that way. The one issue that did come up there was that of digital poverty. Disruption to education was actually the main issue that was coming up, where staff were saying they weren't qualified to work with the young people. They weren't school teachers. Trying to motivate the young people to get up and do something online or work with the children that way was very, very difficult for them. And they're saying the social care workers, it was kind of a dual role that they were doing at that stage. Thankfully, no major issue around social distancing or relationships with other residents or staff. Some other issues that were coming up then was anxiety within the young people themselves, that they would contract COVID, or that some of their family would be as well. And again, the difficulties that they were having around their education placements. Most of the difficulties that the staff said were experiences was, again, the fear of bringing COVID into the house and the implications that would have, not just for themselves, but also for the house as a whole and the young people that were there. Motivation for schooling, as I already mentioned, the time issues and how to be creative to ensure that the day was kind of passing as quickly as possible and that people weren't getting bored. The impact on their work practices was adhering to the guidelines from the HSE, reorganising the goals and expectations of the young people, making sure that too much wasn't expected of those. Briefly, the extra supports that they were looking for was additional PPE. At that stage, the surveys were done around at the end of March and with the month of April. That wasn't fully there at that stage. More communication from TUSLA was asked for at that stage, which thankfully came on board shortly after the results as well. And mental health supports, not just for the young people, but for staff as well. Staff were worried because they were just going from work, or the management were worried because they were just going from work to home, to work to home, so there's no real breaks for them at that stage. Then the other comments were some more access to social media, the health and safety issues, the digital isolation was the big one. And then just in a summary of the major findings of it was, again, that the piece of education needs to be looked at. Family access certainly needed to be looked at as well, to try and organise something for the young people, even if it was ensuring that all parents or all children had some way of having digital technology, and the fear then of staff burnout. So that was just in brief what I did there towards the end of last year. It's available on our website at this stage, and if you have any further questions, just let us know. Thanks very much. Take care. Bye-bye.